Ladies and gentlemen, welcome to the White Coat 2025. Just some notices before we begin. Can you please turn off your phones to silent for the whole duration of the event? Please be aware that this event is being live streamed, and please take note of your closest fire exit. Now, please rise for the academic procession. Thank you.
Good evening, you're all very welcome. You can all be seated. So you're all very welcome this evening to our White Coat ceremony, or clinical commencement, and this marks the transition of our students from the preclinical years to the clinical years. And I think it's really the part that our students have looked forward to since they started, and it's where they get to practice those skills that they've learned in the first few years. So with that transition does come great responsibility also, and I think you've all been very well prepared for this. So I'd like to thank all of the preclinical faculty that have taught you over the last few years and have enabled you to get to this position and provide the foundation for the next couple of years. I'd also like to welcome all your families, obviously, who've supported you this far, and without their support throughout the last few years, this evening wouldn't be possible. So thank you to all of them. And I will now just outline the process over the next little bit. We'll invite the students up in groups of 10, and then the coats will be placed on them by members of our academic staff here. And once we've donned all of the white coats, then our guest speaker, Professor Kevin Conlon, who I'll introduce before he says a few words, he will say a few words. So we'll go ahead and commence. So we'll call up the student. Talal Abdul Khalek. And I might ask to hold the applause till after the groups attend. Hiba Abu Shama, Louis Adelaide, Ahmed Matasaf Saud, Lara Akiki, Mafar Hamad Shamis Al Ofi, Ithar Mohammed Al Matar, Narjis Nasrallah Salim Al Rujavi, Arwa Ali Salim Al Zaidi, Sued Al Abdullah. Thank you. Phoebe Alabi, Fahad Al-Jami, Hussein Al-Bathar, Razan Al-Burhan, Lujan Al-Balushi, Azar Jumabati Al-Busadi, Lina Al-Dafiri, Manar Al-Dusari, Hayat Al-Anizi, James Alexander Lisi. Ariella Alfred, Maria Ayman Al-Frey, Abdulaziz Al-Gadafan, Yusuf Al-Gawi, Amar Yasir Saeed Al-Habsi, Muhammad Salim Nasser Al-Hadrami, Dalal Al-Hajar, Batul Ali, Muhammad Akhaldi, Abdulaziz Al-Khalidi, Abdul Majid Al-Khanfar, Batil Al-Khariji, Nell Allison, Sean Allison, Zara Muhammad Asid Al-Manasef, Jinan Al-Madhain, Faisal Al-Mullah, Durar Al-Khalaf, Yassine Hussein Al-Saif, Yusuf Al-Shamari. Mohammed Khalid Ahmad Saweed Al-Ashar, Azma Ahmad Khalifa Al-Shukali, Fatima Abdullah Al-Tafif, Rishab Sukrit Anand Mahadavan, Beryl Arnold, Saba Adwad, Havanjit Singh Bagri, Ishan Banik, Gabriel Barbosa Blomqvist, Jack Pascal, Aisling Beecham, Abdullah Babahani, Inez Belza Garcia, Adam Ben Jafar, Peter Benson, Kira Blue, Charlie Brady, Evelyn Briscoe, Anya Brody, Grace Buckley. Susanna Buckley, Alice Byrne, Anna Byrne, Rachel Campbell, Shifra Campbell Carroll, Hui Lee Chai, Ian Chan, Sumitra Hui Zien Cheong, Yanjin Bod Chinzarig, Erica Chow. Sam Clancy, Grace Cleary, Charlotte Cody, Dara Collins O'Regan, Kate Conachi, Conor Conahy, Seamus Conlon, Grace Conlon, Shay Corcoran, Jack Crumlish. Saif Kulhan, Leanne Cullen, James Cullerton, Luke Cummins, Mary Curran, Olympia Dadudi, Deacon Dalton, Aaron Daly, Rebecca Daly, Shane Daly. Emmanuel Deolis, Natalie Davidson, Roisin Dempsey, Declan Douglas, Charlize Dupreez, Elaine Duddy, Alice Duggan, Sydney Dyke, Natasha Eckel, Killian Fahy. Conor Farrell, Freya Farrelly, Catherine Finnegan, Kate Finnegan, Niamh Fitter, Anna Fitzgerald, Kieran Flanagan, David Fleming, Hannah Flood, Meredith Foley. Aldo Francis, Owen Gain, Robert Gallagher, Sapphire Gow, Ruth Gardner, Ankita George, Katerina Georgie, Matthew Gibney, Andrew Gilchrist, Thomas Gilheany. Hannah Gilmore, Lourdes Gizir, Sarah Gleason, Carolina Gonzalez Dominguez, Z. Chi Gui, Emma Grady, Daniel Gray, Michael Grealis, Zoya Hadir, Noor Kamir Hanser, Keelan Hanrahan, Sophia Hempelman Perez, Ishan Harath, Cameron Hick, Abigail He, Matthew Hogan, Sophia Holzifer, Rossa Horgan, Owen Hyde, Eri Imamura. Holly Jacob, Ibrahim Yassin Janjua, Mohammed Jaral, Melina Jensen, Eamon Jones, Danielle Joshi, Brianna Joyce, Leonie Judge, Logrago Catolo, Karnur Kaur. Emily Kavanagh, Tom Kavanagh, Cyril Kazan, Ella Keane, Anna Keane, Callum Keenan, Carla Keenan, John Keenan, Daniel Kelly, David Kelly, Sabina Kelly Falk, Nika Kachahaji Dedi, Cheyenne Kimji, Hazel Kiley, Daniel Noop, Sophia Kravitz, Julia LaBelle, Stephen Lally, Edith Lane, Keith Lavin, Matthew Leddy, Mia Leonard, Moe Jan Stephen Lynn, Maeve Loftus Negrody, Aisling Lyons, Aisling McManus, Dara Marnell, Logan Martin, Aisling McCabe, Sheila McCarthy. Paul McCool, Owen McCoy, Finian McCoy, Claire MacDonald, Dervla MacDonald, Harriet McDonough, Leah McDonough, Jessica McDwyer, Luke McDwyer, Leila McGath. Matthew McGarrity, Aoife McGreevy, Alana McGuinness, Niamh McHugh, Jesper Michael Barbadillo, Mazin Mohammed, Noof Mohammed, Mahdi Mohammed, Matthew Moore, Michael Moran, Aoife Moran, Gabriel Morwood, Anna Morley, Zoe Morris, Nathan Mullen, Mark Mulvey, Yusuf Murad, Isabel Murphy, Leanne Murray, Ariel Moyal, Amy Nakahashi, Nia Natu, Shane Neville, Mikhail Newman, Dervla Nigalkor, Alana Nikdonica, Marcus Nordstrand, Mohammed Hassan Obaiden, Lizzie O'Callaghan. Kate O'Donnell, Jacqueline O'Keefe, Damilola Okuga, David Oliver, Rory O'Mahony, Brian Amoro Tiana Moan, Nathaniel Onayemi, Sienna Ormond, Conor O'Tierney, Helena Paran, Adam Patterson, Cara Payne, Elizabeth Petit, William Fair, Danielle Polirer, Jisoon Purnaselvan, Stella Price, Cathal Rafferty, Niamh Rafter, Mahima Ramaswar. Quiva Riley, Phoebe Reynolds, Owen Roach, Stephanie Roach, Isabel Roach Rodriguez, Chloe Roden, Sarah Rowland, Laura Ryan, Joseph Ryan, Suri Sahil. Keen Searing, Ahmad Shahid, Sindhuja Shankar, Oshin Shannon, Roshin Sheehy, Sukaina Ali Al Shahab, Mariam Shahabi, Anna Sheridan, Michael Smith, and Shannon Smith. Harriet Smith, Scotland, Ruth Smith, Isabella Suarez, Alexandra Sukop, Catherine Spellman, Stephanie Spencer, Kaya Stasiewicz, Teresa Sunny, Rohit Sankala, Nicholas Kai ZT, Bhavya Tulazi Kumar, sorry, I jumped the gun. Taya Tijo, Grace Tormey, Matson Tulloch, Matthew van der Hayden, Jessica Vasant Harsan, Matisse Wegemaker, Kate Waldron, Nicholas Wall, Tara Walsh. Ronwyn Waterson, Alison Weber, Austin Elliott Wongso, Torin Wright, Sophie Yang, Dara Yildiz, Joanne Zijmo, Suyun Zhang. So today we were joined this evening by almost 300 students and 600 guests from 29 countries around the world, including Botswana, Canada, China, India, Kuwait, Malaysia, Oman, Saudi Arabia, Ukraine, the United States, and of course Ireland. So I'm sure everybody will join me in congratulating you all on your achievements thus far. Now it gives me great pleasure to introduce our guest speaker for this evening, is Professor Kevin Conlon. Professor Conlon is adjunct professor and fellow emeritus at Trinity College Dublin, previously been chair of surgery at Trinity College from 2002 to 2023. He was also a pathobiliary surgeon and surgical oncologist based at St Vincent's University Hospital Dublin and Tala University Hospital Dublin. His main clinical and research efforts related to benign and malignant diseases of the pancreas, and for many years he was the senior surgeon at St Vincent's Hospital, which is the National Centre for Pancreatic Cancer Surgery. Despite having been at Trinity College for many years, he did originally graduate from University College Dublin, and he trained in general surgery, the Royal College of Surgeons here in Ireland, and then Washington University School of Medicine in St. Louis, Missouri, completing his surgical oncology training at Memorial Sloan Kettering Cancer Center in New York, where he was on staff for several years and highly regarded, and still a highly regarded pancreatic surgeon at Memorial Sloan Kettering. He's widely published. He was editor-in-chief of Digestive Surgery, and he served on the editorial board of multiple international journals. He's had many international awards. He was president of the European African Hepatopancreatico-Biliary Association, Secretary General of the International Hepatopancreatico-Biliary Association, and he served as vice chair of the Union Européenne de Médecins Spécialistes Division of HPB Surgery, and also president of the UEM HPB Board of Examiners. He's currently a member of the Council of the Royal College of Surgeons in Ireland and the Council of European Digestive Surgery. He's a member of the European Surgical Association and the International Surgical Group, and is also past president of the Pancreatic Society of Great Britain and Ireland. So it gives me great pleasure to welcome Kevin.
Michael, thank you for that very kind introduction. So Dean, colleagues and guests, and of course the class of 2027, I am honoured and privileged to join you this evening for this very special ceremony. As the Dean has said, this is an important milestone for each of you, and it symbolises important transition in your professional journey from preclinical studies to that of the clinical arena and direct patient care. Whilst this transition to the clinical arena has been part of the medical student experience for millennia, this actual white coat ceremony is itself of recent times. It's said to have originated in 1989 in the University of Chicago Medical School, but the very first fledged ceremony like this one occurred in Columbia University School of Physicians and Surgeons in New York in only 1993. And it was organized in a way to emphasize to both the faculty of the school and students the ethical responsibilities inherent in medical training. So the white coat you have received this evening stands for something. It stands for integrity, compassion, and dedication to service. It is not to set you apart from other students, but rather emphasizes that taking care of patients is a privilege which is associated with responsibilities and service. So while in this college this is a more recent development, receiving your white coat today symbolically links you, the class of 2027, to past and future medical graduates of this university. I believe that this nexus is important as it represents a continuum of shared values being handed down from generation to generation. It is this shared ethos which will afford you a strong ethical foundation as you move forward in your chosen career. As the Dean said, I am a graduate of University College Dublin, but I find it hard to comprehend that I entered this medical school 50 years ago this year, and things have certainly changed. In that time, not only has this campus undergone phenomenal development, I got lost coming here this evening, but the practice of medicine itself has seen remarkable changes. But what has not altered is that care and advocacy for the patient is and remains the central core of all our practice. As I reflect on my own personal journey from a medical student in this college to training as a non-consultant hospital doctor in Ireland, the UK and the US, becoming a consultant surgeon and ultimately professor of surgery in Trinity. It is not the papers I wrote, the grants achieved, the procedures performed, or the countries visited, or indeed the invited lectures delivered that have given me the most fulfillment, but rather it is simply patient care. Mentorship is important, and I have been lucky in my career to have a number of great mentors who emphasize the centrality of patient care and the importance of taking time with patients, being observant, and being an active listener. They taught me that there's more to patient care than being a mere technocrat. I suppose as an illustration, in my clinical practice, I would see patients with pancreas cancer. And when I saw a patient for the first time, as you'd expect, I would take time with their history, examine them, review their biochemical and radiological data, explain the significance of their diagnosis, discuss its implication, their impact on their life, the various treatment options, and finally, to the best of my ability, answer the questions that they would have. And this is an encounter that could not be rushed. When they left the room having seen me, they were often very shaken, and they would be met by a nurse clinician who, working with me, who'd ask them, "What did he say?" And invariably, they'd answer only two things. Firstly, he said, "I have cancer." And secondly, he said, "You all will take care of me." Now, at first glance, this may surprise you, as it did not include all the issues, the treatments, and the prognoses which I had discussed in detail. But on reflection, it makes perfect sense, as it was the human reassurance that they would be taken care of that was so important and so key. To paraphrase a quotation attributed to the American poet and civil rights activist Maya Angelou, "People will forget what you said. People will even forget what you did, but people will never forget how you made them feel." This year, you will be meeting patients for the first time and developing what is often referred to as your bedside manner. It's important to understand that as you do so, the vast majority of patients and their families you will meet, irrespective of the setting you meet them in, will be vulnerable and fearful. You must learn as you interact with them to demonstrate empathy, humility, honesty, and integrity. All of us working in the clinical arena have privileges and responsibilities. Patients are consenting to share often very personal and intimate details and allow their personal space to be entered for examination and treatment. Our duty is to respect this, maintain confidentiality, work entirely for the good of the patient, and avoid doing harm. Just be kind, be thoughtful, and be respectful. It is actually quite simple. Treat your patients the same way you would like to be treated if you were in their shoes. Or put it another way, look at the classmates sitting beside you on either side of you and think of how you would expect them to treat you if you were as a patient. Or how would you expect them to deal with your parents or grandparents? It is, in some respects, that simple. Yet patient care can be overwhelming, all-encompassing, and frequently quite difficult. In the main, we as physicians are taught to manage illness, balancing the consequence of the disease with the potential impact of our interventions. This can often be uncertain and difficult for us as a doctor, as well as for the patient and their families. And it is clear that medical care is becoming more and more sophisticated. And while competence and expertise in medical science and technologies is clearly important, I strongly believe that these skills need to be complemented by compassionate and empathetic care. So it is this blend of excellence in science coupled with a caring ethos that is the core of our healing profession. So as you move forward in your clinical journey, undoubtedly you'll experience considerable highs and lows. The highs of making a difficult diagnosis, of nailing a complex and risky procedure, restoring someone to full health, or seeing how your compassionate care improves their quality of life. But of course, there is another side to the coin. Being called in the middle of the night, particularly early in your career, to a very sick patient, when you are unclear and fearful that your diagnosis or intervention is correct. Or as a surgeon, when the procedure gets away from you and the outcome is suboptimal. Self-doubt creeps in, anxiety and sleepless nights follow. These are normal reactions. As I said, taking care of patients can be daunting. But it's important that you are supported and that you support others. You need to be adaptable, build resilience, and embrace collegiality. Importantly, you need to realize that asking for help is not a sign of weakness, but rather a sign of strength. Do not forget your family and friends. In fact, develop another life outside medicine. Spend time taking care of yourself. Have an interest, a hobby, or a sport. It's important to clear the head and not be overwhelmed by the here and now. That is so important as we live in uncertain times. If you look around the world today, it appears to be in turmoil, and one can plausibly say that the predominant sentiments expressed are that of anger, fear, and dare I say, despondency. And in Ireland, we are no different. Yet here in Ireland, despite undoubted challenges, I would argue that over the last 50 years, there have been remarkable changes for the better in our society, and I include our health service in that. We all are living healthier and longer. For example, the likelihood of a child surviving their first year has increased by 25-fold over my career. Cancer mortality is declining, with survival rates in Ireland for common cancers outperforming most EU averages. Deaths from heart disease have decreased by 2/3, and public health spending has increased 14-fold over the last 40 years. But that having been said, there remain considerable concerns with healthcare delivery. There are significant issues with universal and timely access to care, capacity constraints, spiraling costs, lack of staff or resources. And this occurs across a range of disciplines. Furthermore, societal expectations regarding our profession have appropriately increased, but in many cases, they may be considered unrealistic. Patients frequently are frustrated and angry with the barriers to obtaining appropriate care. You will be in the forefront of dealing with this, and believe me, it can be very difficult. So whilst the medical career can be daunting and have undoubted challenges, it offers a myriad of amazing opportunities. You will develop expertise, skills, and many of you will travel the world. You all will have your unique possibilities. Advances in molecular genetics have led to exciting understandings of the biological basis of disease, and this, coupled with advances in artificial intelligence, development of novel therapeutics, and technological innovations, will fundamentally change the approach to many common diseases, such as cancer and obesity, to name but two, during your careers. I have absolutely no doubt that we are on the cusp of significant and achievable gains in patient care. Conditions for which my generation may have been intellectually stimulating, but had few effective therapies and offered little hope for patients, will in the near future be understandable, have effective therapies, and offer sustained benefit for your patients and society as a whole. This is incredibly exciting. You, the class of 2027, are the future. Your generation will be at the forefront of these advances, and you will be able to have a leadership role in how they are developed, improved, and implemented. This class of 2027 is your challenge. I would ask you to block out the naysayers. Be optimistic, be resolute, and embrace the future. Now, this evening, as the Dean and others have said, is very special. You can be so proud of your achievements to date, and you can look forward to the future with positivity and confidence. Look around you, to your parents and friends, and thank them for their support and encouragement. They will have sacrificed and are your partners in this journey that you are undertaking. I have a special thought for the mothers in the audience. I would not lose heart if your pride and joy leaves Ireland to train and work abroad. As my own experience shows, ultimately, the Irish homing gene is strong and they'll most likely return. Nonetheless, to the class of 2027, I would encourage you as you move forward in your own personal journey to take on board what the American essayist Mark Twain said. 20 years from now, you will be more disappointed by the things you didn't do than the things you did. So, throw away the bow lines. Sail away from the safe harbor. Catch the trade winds in your sails. Explore, dream, and discover. Thank you for your attention. Congratulations on your achievements to date, and best of luck.
Thank you very much, Kevin. And that concludes the formalities for this evening. There's one final thing we'll do. We'll ask all the students to stand and turn and face the camera upstairs so we can take a group photograph. And I'd like to invite all the students and your guests to refreshments in the atrium next door following the procession.